Okay, good evening, everyone out there, and thank you once again for joining us on Yes to Help Live. We are privileged to have with us today a very great professional who will take us through yet another great topic. And this topic is kidney diseases, prevention, and cure.
Oops. You are breaking. Okay, I think you are breaking a bit.
Yeah, it's fine now. Yeah. Okay.
Yes, much
Hello, is
better.
it okay now? Yeah, okay. It's fine now. Okay. Yeah. Thank you once again out there, please. Um, Thank you once again out there.
Is it? It's the feedback, right? You are still breaking. Can you hear me now? Can you hear me now? Hello?
Yeah, I can hear you now.
Okay,
Yeah,
great. Okay. So you
yeah,
are breaking with very bad feedback, so
yeah.
that's why I muted.
Is it
Okay,
okay now? Yeah, yeah, I can.
okay, great. All right.
Yeah, I
Over
can
to
hear
you.
you. Yeah. Please introduce yourself to our viewers out there, please.
Okay, so my name is Elliot Tano. Simply, I am a physician, special interest in kidneys, so I'm a nephrologist. So kidney doctor, you can call me. And I'm the CEO of Kidney Consult. So it's a kidney advocacy group where we hope to prevent kidney disease in Ghana and beyond. And I'm happy to be on this platform to discuss kidney disease and how to prevent it because that's my passion.
Okay, thank you so much for your time once again. We are here to discuss the topic kidney diseases, preventions, and cure. To start with, when we say kidney diseases, well, what is the kidney itself?
Okay, you are still breaking, but if I heard you, Christiana, I think it's more about you want to know what the kidney is about, right? And its function. All right. So kidney,
Yeah.
there's amazing organs. I call them amazing organs because they do more than we think they do. Generally, each of us, if everything goes normal, would have two kidneys, which are virtually in your body. So they sit somewhere close to your back. So if you come in and you have a kidney problem and I want to have a piece of it, I'll let you lie on your tummy and then I take a piece from the back. So it's closer to the back than the front, if you understand what I'm saying. And it has a lot of functions. And indeed, what most people will know about kidneys is that
Oh,
it helps you to make urine, which is true. So that is actually one of the major functions of the kidney. It helps you to make urine. And this urine has, most of the bad products that your body does not want. That is what actually goes into the kidney and you pee it out when you are fine. But apart from this basic function of the kidney also helps us to control our blood pressure. So, Christian, as you sit right in front of me, how your blood pressure is able to stay normal at all times, the kidney has a major part to play in it. And that is why when people come in, more especially the young people, and they have high blood pressure, the first question I ask myself is that how well is the kidney? And indeed, blood pressure or hypertension is actually one of the very common ways by which
yeah.
people present or come to us with kidney disease. So, like I mentioned, the kidney helps you to control your blood pressure. The next is that the kidney also helps you to make blood. I think when I say this, most people don't appreciate it, but guess what? When the amount of blood in your body goes down, it's actually the kidney that tells the part of the body that makes blood that listen, the blood of Christiana is on the low side. Let's make some more, and then they go ahead and they make the blood. So what it means is that if the kidney function is low, then unfortunately, when the blood levels are low, there's nothing to tell what makes blood that come on, make some blood. And they tend to walk around with very low levels of HB or for that matter, their blood level, for which sometimes they move from hospital to hospital and they are just transfused or they are given blood products without finding out the cause
Yeah.
of why their blood levels are constantly low. Because the kidney has a major part to play so far as blood making is concerned. The other thing is that the kidney helps you to control the amount of water in your body. If there's too much water in your body or there's too less water in the body, it's the kidney that controls it. So then you pass less amount of urine or more depending on how much water you have in your body. So when you are in the Sahara Desert, for instance, you shouldn't die because your kidney will ensure that you don't urinate a lot so that at least you can sustain yourself. So that's actually one of the major things the kidney does. And again, The kidney helps to control a lot of things in the blood. So it helps to make sure a lot of things that we are not mindful of are well controlled so that they don't go too high or go too low. So I think basically these are just the simple functions of the kidney I expect everybody to know about. Over to you, Christiana.
Okay. Okay. So we are discussing kidney diseases. What are these kidney diseases and how many are they? How many do we have?
So it's not as if you have some number of kidney diseases. In fact, if you are to number the kidney diseases, probably there are like 100 or 1,000. I don't know. There are so many of them. But generally, we try to group them into what we call acute. So things that can just happen to your kidney in a couple of hours or in a couple of days, for which the advantage is that at least you can cure it. So I'll give a perfect example. So just imagine you get some very bad diarrhea, all right? So you have been pulling yourself all along, maybe about 10 or 20 times a day, for which the amount of water in your body becomes so low, and then the kidneys now will have very little blood getting to them, and then they can be damaged. You can have situations, or you go and take some medication that is not too good for your kidney today, maybe, and the next day, all of a sudden, you are not urinating. So you can have things that can affect the kidneys before them acutely over a short period of time. The good news with them in that category is that the moment we are able to clear it, or the moment we, should I say, find a reason for why it is so, and you are able to correct it, the patient or the person comes back to normal. On the other hand, the one that is most dangerous is what we call the chronic kidney disease. So, for that matter, these are classes of diseases that will affect the kidney, but it will do so slowly over a long period of time. When I'm talking to people, these are the ones that I tend to spend a couple of time on, and there are various ways by which people get these kind of diseases. So now the key is that with the chronic ones, you might be fine, you might be going about your activities, but your kidney functions will be going down slowly, slowly, slowly. And until it is late, you'll now come to me and then go like, oh, now I cannot pee, or now my feet is swollen or something. That will go like, oh, maybe your kidneys are not functioning the way they are supposed to. And if I talk about this, that is why I'm really passionate about the fact that there's always the need for an individual to always check once the whole, just know the level of their kidney function. Because if you don't, you would run into trouble. And unfortunately, by the time you run into trouble, it will become too expensive to treat you or to manage you. And that might lead to your death, or for that matter. So that is why I'm particular about. So now that you've asked, the next of importance is to find out what will cause this chronic kidney disease I'm talking about. All right. So worldwide, I mean, generally, the number one cause of kidney disease is diabetes. All right. So diabetes is the number one cause of kidney disease. Why is this important? If you know you are diabetic, you are listening to me, you are watching me, and you are diabetic, your family members or your mom, your dad has diabetes, know that your risk of kidney disease is high, meaning that you have a chance of getting kidney disease because that happens to be one of the most common causes of kidney disease. So watch out. Now, the next that I would want to discuss is hypertension, or for that matter, blood pressure. So, Christiana, you realize that I mentioned to you that the kidney is actually the organ in our body that helps us to control our blood pressure. On the other hand, when you have high blood pressure, maybe you are in a
Yeah.
family where your mom is hypertensive, your dad is hypertensive, and maybe you become hypertensive at age 40 or 50 or whatever it is like. If you don't control this blood pressure with medication and it continues to stay high, it destroys your kidney. And indeed, it doesn't destroy only your kidney, it can affect your brain by giving you stroke. And I have a feeling you know stroke, Christiana. And then it can affect your heart by giving you heart attack, or the heart will fail eventually. And it can affect your blood vessels, the ones that pump blood to and away from the heart. And again, it can affect your kidney. So blood pressure, high blood pressure is very important. And more often than not, every year I advocate that people check their blood pressures, because now young people are getting blood pressures. Now you don't need to be 50 or 60 to get hypertension or blood pressure high. Young people, I have 50s, I have 20s, I have 25, 30s, and all getting high blood pressure. So if you have high blood pressure, you need to check it because again, by itself, it can give you kidney disease, and kidney disease can also what cause you to have high blood pressure. Apart from this one, there are a group of some conditions that can affect the kidney itself, how it's able to filter, and by so doing, destroy the kidney. There's a big term which I'm not going to mention because it just tends to confuse people. But this is actually why I am so mindful of the fact that you need to ensure that you always check to see what your blood pressures are because you don't know or your kidney functions are because you don't know which of these things can affect your kidney. Apart from that, if you are not able to urinate well, so when men
Yeah.
go and we are about 50 or 40 and above, sometimes when you go to stand to pee, the urine does not come with force like when you were young, like 6 years, and you can urinate from here and it gets to you, Christiana, where you are sitting. But unfortunately, you find yourself now peeing and it's just dropping right in front of your shoe, meaning that it's not able to flow strong enough. The stream is not strong. When that happens, we worry about an organ in our body called, for males alone, the prostate. So if you have a prostate becoming enlarged, your urine that you make is not able to come out of your body easily. And unfortunately, sometimes over a period of time can also affect the kidney. There are a couple of infections like HIV. People know HIV/AIDS and the fact that they will cause you to become lean and all of that stuff. But what they don't know is that HIV/AIDS can affect the kidney. People know about hepatitis B, but what they don't know is that hepatitis B can affect the kidney. So Christiana, that's why I mentioned that if you want to know the causes of kidney disease, I have a feeling I can talk for the whole 1 hour telling you about all the causes and we might not finish. So I'll pause here. So maybe if there are questions, you can do them.
Okay, so what I know you've explained the disease about, and then you've made mention of some other related diseases like high blood pressure and stuff. What you have to look out for?
No. Yes. I'm not sure I heard your question. You're frozen again.
Yeah, I said what are some of the causes and
Symptoms. Okay,
symptoms?
thank you very much. So,
What are some of the causes and symptoms that we have to look out?
okay. So I have, thank you very much for that question. I've actually talked about some of the causes, not all because I was probably taking all the time. But the symptoms, indeed, when I'm asked the symptoms of chronic kidney disease, the first thing I tell people is that don't wait for symptoms. Okay. If you want to sit and wait to see a symptom to now worry about kidney disease, unfortunately, by that time, it might be too late. So, what I advise people is that once a while, more especially 30 years and above, 20 years and above, depending on the risk of kidney disease in the family. And I think one thing I forgot to mention is that kidney disease can actually go through families. There are some causes of the kidney disease that when a mother has or a father has, they can give it to their children and so on and so forth. All right, so just in passing. But the point is that at age 30 at least, or maybe younger, once a while, check to see how well your kidneys are functioning because I'll make a strong statement. Chronic kidney disease is normally without any symptom. I'll repeat this. Chronic kidney disease is normally without any symptom. Normally, when I talk about this, and it's some of the things I've actually written in my book that hopefully will be launching soon, that it is like we using a mobile phone. Christiana, when you wake up in the morning and you charge your mobile phone to 100%, you sometimes will use the mobile phone to make calls, to browse, and
Yeah.
all of that. And you might not know that the 100% you had in the morning has reduced to, let's say, 80 or 70 or 60 or whatever it is like. So if you keep using your phone and making calls and browsing and all, you'll get to a point, maybe 15%, 20%, and then your phone will say maybe low battery or charge or whatever it is that your phone will tell you. Now, that is exactly how the kidney works. By the time it gives you a signal that there's a problem with the kidney, chances are that you might be dealing with what, a 15 or 20%. So, what I advise people is that if you know your mobile phone is not good enough, I have a feeling even if you charge it at 100, in the course of the day, you keep looking at the screen to find out where it is so you make sure you get a charger charged before you run out. Is that not so? And that is how I expect people to look at their kidneys also. If you have no idea how your kidney is working, you might not even know that you need to be looking on the screen frequently to find out whether it is working well or not. So what I advocate is that don't wait for symptoms. I'll repeat again, don't wait for symptoms. Keep checking your kidney functions at least once a year. If you have high risk of kidney disease, you probably might need to check it a bit more frequently, but don't wait for symptoms. Now, the other thing I would also want to mention quickly is that sometimes it might come with some symptoms. Obviously, you realize that if, as I keep hammering on don't wait on the symptoms, it means you are not supposed to wait on the symptoms. But then the point is that it might sometimes come with some symptoms, of course, for which you need to report. So when it comes with symptoms, the question is, what are some of the symptoms that kidney disease will present with? Okay. So when you have kidney disease, you note that sometimes you are waking up a bit more frequently to urinate at night. When I say this, people get scared. Oh, I drank a lot of fluids before I slept, okay, and all of that. So if I'm peeing or I'm urinating more often at night, doesn't mean there's a problem. So diabetes can do that. Infections in your urine can do that. There are few other conditions that can do that. But again, kidney disease can also do that. Or you realize that the amount of urine you are making reduces. If the amount of urine you are making reduces significantly, then probably you might also be having kidney disease. So you may have to what? Check it. Are you urinating for it to contain blood? Or have you done a urine test for them to say that there's blood in your urine? It might be a sign of kidney disease. Have you probably had your feet swollen? So some people will say, oh, nowadays when I sit in a car for a long period of time, then my feet get swollen and all of that. Now, the question is that if your feet are getting swollen, there are some conditions that can do that. It might be because you have a kidney problem. It might be because you have a liver problem. It might be because you have a heart problem. All of these things might cause your feet to become swollen. So when your feet is becoming swollen, don't wish it off, or don't assume it will just go away. See your healthcare provider, see your doctor, for them to find out why it is so, and they might be able to give you medications to help treat that. And that is very important, because if you don't and you ignore, you'll find yourself in trouble. Again, like I mentioned, some people will continue not to come with anything, and they'll come with very low HBs, or they might come and they are feeling dizzy. Anything they do, they become easily tired. And then if they walk a short distance, they are all tired and all of that. Their doctors would investigate them and say, oh, their blood levels are low and all of that stuff. If your blood level is low, like I mentioned from the beginning, if you join and you are not able to find a clear reason, you are not bleeding from anywhere, you are not having heavy menses and all of that, let your doctor find out why your blood levels are dropping. For all we know, it might be a sign of kidney disease. All right. So that is also very important. If your blood levels are dropping, you are becoming easily dizzy, you are feeling your heartbeat. Sometimes you are just sitting and then you feel your heartbeat, boom, 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 boom. When you are just sitting, ask yourself, normally when we run very fast, maybe if a lion is chasing you or something and you run very fast, that is when, oh, you feel your heart beating, when you are panting and trying to take a little breath. But then the point is that if you have not done all of these things and you feel your heart beating, sometimes you ask yourself that, is my blood level low, or do I have hypertension and all? And these are all sometimes some of the symptoms by which kidney disease will present. Again, if you are not doing anything about it and it's getting worse, then it gets to proportions where, unfortunately, now it gets to state where now your body cannot maintain the amount of urea in your body. And then sometimes people become nauseous, or they feel like they want to vomit. Sometimes they are vomiting by itself, they cannot eat, and they are feeling very sick. Unfortunately, Christiana, this is where most people will come with their kidney problem. Unfortunately, at that level, you realize that now it becomes difficult and they cannot sit at home anymore. And now they rush to the hospital because now their kidneys are virtually shutting down. And at that level, we see the kidneys have virtually failed. In that case, then you probably may need dialysis to be able to sustain yourself on, or to live, or else you're going to die, unfortunately. So the key is that don't wait for some of these symptoms. Check it. Sometimes they can also come with seizures or epilepsy or convulsions and all, or they can come in coma. And indeed, when they get to those stages, I'm afraid it might be death. That is, we'll be looking at them, except they are able to get some dialysis done as soon as possible, and where they are in a place where they can afford it, or maybe their insurance can take care of it. Over to you, Christiana.
Okay. So how do you diagnose them?
All right. So generally, so as we are having the discussion, maybe somebody is watching, somebody might listen later or watch the video later, and you would have heard all the symptoms I talked about. So that is actually some of the things you may need to. And like I mentioned, don't even wait for the symptoms. So get yourself checked. I mean, you can walk to your healthcare provider and they'll be able to check it, I mean, for you. So how we know that somebody has a kidney problem is that, of course, when you come in, we'll ask you a few questions. Okay, how old you are, whether you have a family history of diabetes, hypertension, kidney disease, and so on and so forth, and have whether you have taken any medication. Indeed, now that I'm talking about medication, let me highlight quickly that sometimes medications also will cause kidney disease. All right. So I'll start off with medications that we can give, Christiana. As doctors, we write medications for people. Now, these medications we write, sometimes, depending on the level of people's kidney function, it can cause more harm than good. Now, we have done tests to know that these medications now will cause this harm. When I talk like that, then I go on to talk about herbal medication. Let's be wary about herbal medications that we take. Herbal medications can be good. I agree that they might be good. But the question is that as good as they are, sometimes you don't know the effect they may have on some organs of your body, on your heart, on your liver, and on your kidneys. I have sat in a place where I've seen a lot of people consume all sorts of herbal medications with all sorts of impacts to their kidneys. I've had debates with people who are peddling herbal medication and they keep saying that, oh, as for herbal medications, it's without side effects and it is pure, it is natural, it is whatever it is like. And they are quick to say that, oh, as for you and your medications that you write, according to DMO, people have used all sort of things, so they are not natural. That is why they give side effects. And normally, what I say to these people is that, listen, we all eat banana, all right? When we are taking banana, we peel off, the skin and we eat the fruit, right? Now, the peel is also natural
Yeah.
as compared, right? But the question is that as natural as the peel is,
Yeah.
Christiana, you don't take the banana and shove all the banana into your mouth. Do you do that? You take the peel out because
Yeah.
nature has it that, of course, the fruit that is within is what is helpful for you. But the peel might not necessarily be helpful. That's why we don't chew the peel. So when you are taking herbal medication, be careful. There might be some content that might be good for you, like the banana example I'm giving, but there might be the peel that probably might not be good for you. And that is why most of the medications, the orthodox medications, we doctors, right, would have gone through some screening to go like, okay, this is the good part. So let's use the good part and not use maybe the bad part. But even with that, we still have side effects with medication. So when you are taking herbal medication, please don't assume hook, line, and sinker that it is pure. Because, like I said, I don't want to mention names of some of herbal medications, but I've sat in a place where we are seeing people come with all forms of kidney diseases from the consumption of some of these herbal medications. So be wary. And I keep saying that when these herbal medications are being prescribed, they will
Yeah.
quickly say, okay, maybe if you are pregnant or you are a child less than 12 years or 18, don't take it. But what I have not heard one of them say is that, okay, if you have liver disease, don't take it. If you have kidney disease, don't take it. If you have heart disease, don't take it. Because they've not done research into these areas to know how the effects of these herbal medications are on these organs. Unfortunately, for my kidney disease patients, they might sometimes go and take these herbal medications already when they have a kidney problem. So let's be worried. Now, coming back to your question. Now, how do we know? So I'll ask all of these questions, whether you have taken herbal medications, whether you have taken any medications that we have set, and then we'll be able to risk stratify. If you are diabetic, you are hypertensive, or you have done some of these things, then your risk for kidney disease goes high. We can draw a simple blood test. So we just take a little blood sample, take it to the lab, and we can have a fair idea of how your kidney is working. We can also take some of your urine, send it to the lab, and we'll be able to know how your kidneys are working. Okay. And then again, we can do an ultrasound of your kidneys. There are some people, like I mentioned from the beginning, God has graced most of us with two kidneys, but it's not everybody who has two kidneys. There are some people with one kidney. Okay. There are some people who live their lives to the max, but they only have one kidney. So by ultrasound, we're able to tell whether you have two kidneys and whether
Yeah.
all the two kidneys are functioning normally. Okay. So these are some of the basic ways that which we are able to know how your kidney functions. But depending on what level they are, because like I said, the blood pressures and all, we check the blood pressures, we check your sugars and all, because all of those things gives us a fair idea of whether your risks are high and whether you can get kidney disease. So blood sample, urine sample, and ultrasound, checking your blood pressure, checking your blood for sugar, or diabetes are very simple ways by which we are able to detect whether somebody has kidney disease.
Okay. So what are some you made mention of treatment. What are some of the treatment apart from the medication? What are some of the treatment given to someone with the kidney disease?
All right, so thank you. When it comes to the treatments, normally we'll try to break them down into those who have just the kidney disease and their kidneys have not failed yet, and those whose kidneys have failed. All right. So for those who have the disease and the kidneys have not failed, the important thing we try to do is that we want to prevent the kidneys from destroying or from getting deteriorated or more causing more or having more damage. So we call it that we want to prevent it from progressing and becoming worse. What do? We need to now advise you if you got it from hypertension, make sure you take your blood pressure medications and make sure the blood pressures are normal. If you got it from diabetes, you need to ensure your diabetes is well controlled. If you got it from taking herbal medications or taking any other medications, we'd advise you to stop taking these medications because then, of course, we'll prevent it from destroying. So the key when you don't have failure yet is to ensure that you don't cause it to fail. Okay. But unfortunately, about 80% of my patients will come in when the kidneys have actually failed, which is very sad. So these people, when they come in and it has failed, the only discussion we can have is that, okay, how are they going to get dialysis done? Is that okay? Dialysis is the treatment or the management for kidney disease.
Yeah.
So what do I mean by dialysis? Dialysis is the machine because the kidney cannot get rid of all the bad things that you have eaten and all the toxins that are in your body. Then we now have to go and beg a machine to come and clear your system 3 times a week so you can go about your activities. So that is where dialysis comes in. The other thing is what we call peritoneal dialysis. For you guys in the UK and all, you realize that people they have kidney disease, but they don't go to the dialysis unit 3 times a week. So they have it at home and they are able to do it at home. They connect it to there's a tube connected to their belly, and then they put fluid in their belly and they can go about their activities after 4 hours. They take the fluid out and they put in a new one. And they do what we call like 4 exchanges in a day, and then that is able to sustain them until they are able to get what we call the ultimate cure or the ultimate treatment for dialysis, which is, of course, just like a car, when your carburetor or when your tire spoils, the advice is that you get a new tire, or you get a new carburetor, or you get a new whatever that is spoiled. Okay, so the dialysis you can think about it like servicing your car, but the transplant is like what getting yourself a new part, right? So your mechanic will tell you that, oh, since you know the gearbox is spoiled, you are better off getting a new one. You realize that getting a new one is actually better than keep servicing it because you waste more money trying to service it over and over again. That is how dialysis and transplant is. So transplant is actually the best cure or the best management for people who come with kidney failure, because in that case they are able to now recover all the functions that I've talked about, which the people on dialysis will not be able to. The people on dialysis, unfortunately, the moment they get off dialysis, they become sick again. So they have to keep going 3 times a week until their kingdom come, I call it. But when you get a transplant, then of course, you don't need to go back to get your dialysis done. And you may be able to have your life and you may be able to live longer with dialysis. So as I speak to people, I advocate if you have a relative, you have a friend who needs a kidney, you can donate safely one of your kidneys to the person because, like we've mentioned, you can actually live well on one kidney. Over to you, Christiana.
Okay. There's a question. It says I have an acute kidney
Yeah,
problem. How long will it take for me to fully recover?
yeah, thank you. In fact, whoever asked the question, in fact, you are blessed that it is acute. In fact, the acute recovery is dependent on what has caused it. You know, there are some people who come, let's say, and it's acute and it's from diarrhea vomiting. The moment they come in, we set up IV line or we give them fluids, plenty fluids. They start urinating, and in a couple of days, up to a week, their kidneys are back to normal. But there are some conditions that might take a bit more, maybe from 3 weeks or a month, and
Okay.
sometimes, depending on what the damage is, it probably might take about 3 months and all. But the advantage with the acute is that it recovers. That is if the right diagnosis is made. If the right diagnosis is not made, then you realize that it doesn't recover as fast as we would want it to. And rather than talking about recovery and acute, I'll mention that pregnant women are actually the ones. Sometimes you get pregnant, you get high blood pressure, you get what we call preeclampsia. It's a big word, but all it means is that you get high blood pressure in pregnancy and you have protein in the urine. And sometimes they can come with convulsions and all. And it affects
Yeah.
their kidneys also. The good news is that the moment they come in and we see them and we correct it, even before they go home, they are urinating well and the kidney functions recover fully. That is, if there is no underlying chronic problem. Okay, so there's hope that they will recover. Yeah,
Okay. And I've heard about this dialysis that people call that it's painful. What happens? Why is it painful?
I won't say it is painful. It is not painful, but you see, before we can dialyze you, just like before we can give you blood, we need an access. We need a place to get the blood into your body. Okay. So the dialysis, we've mentioned that the key ingredient to the dialysis is that you have eaten, you have drank, your body has gone through a lot of processes. It's made products that needs to come out, but because your kidney is not working, it cannot get it out. So the dialysis has to now clear it. It's a machine that will take your blood, they will clean it and give you back your blood. They will take your blood, clean it, and they'll give you back your blood. And you're supposed to lie on it for about 4 hours for the whole process to go over because it keeps exchanging over and over again. And you need time for all the dirt in your blood to put the dirt in your blood to come out from the machine, and then we can give you. So it is not necessarily painful, but what happens is that the access or the way by which the blood is taken out of the body or given, we call something the vascular access. That is what can be painful when the needle is going in. We have AV fistula, so they have to prick you, and the needles are really big because we need big volumes of blood to come in and out. Okay, so that is why it is so. But the process itself is not painful because when you watch them on television or you watch them in the unit, they are lying down comfortably. Some will even fall asleep, or they are watching television, or they are playing with their phone. So the process itself is not painful. But to get the vein, it might be a bit painful because the big needle, and if you are using a catheter or a dialysis access, maybe sometimes it might be painful. But otherwise, the process of dialysis itself is not painful.
Okay. What about kidney stones? Is it also part of the kidney diseases? And what causes that kidney stones?
Lovely question. So normally, when I'm discussing chronic kidney disease, I probably don't talk much about stones because they are in a category by itself. But since you have asked, I have a feeling your listeners will want to hear about it. So I'll just take a few minutes to talk about stones. All right. So unfortunately, our kidneys can produce stones. And when we talk about stone, it's not figurative, it's actually a stone. If a patient's stone is taken from their kidney and I throw it to you, Christiana, on your forehead, it can break. All right. So it's like a stone. It's like a stone. It's like stone. It is a stone. All right. So now what happens is that
Yeah.
if people don't take anything away from me, what happens is that stones happen to be very common amongst young people. All right. So you and I are at risk of stones. Why? Because we are the ones who are not drinking enough water. We are the ones who are busy going about our activities. We are the ones who might be sweating a lot and not drinking enough. So that is why it tends to be common in young people. In fact, I tend to see stones within the ages of 30 up to 40. In fact, early 30s. That's actually my normal patient, early 30s. And they will come to you complaining of severe pain. That is how it presents. Severe pain. And that pain is actually not because the stone has malformed. It's actually because now the stone is leaving the kidney and it's not getting to your bladder. And as it is getting through that little tube, it is painful. It is so painful that sometimes you have to be admitted into the hospital. So if you want proper pain, kidney stone is a
Yeah.
cause of proper pain. So don't get kidney stones. How can you not get kidney stones? I beg you. If you have not drank water, like I've taken my water in the day, please keep drinking water. I'm drinking for them to know. Please drink a lot of water. Why does drinking a lot of water help? It helps because the stones are formed from calcium and a few things that are in your body. And when these things become concentrated, if I say concentrated, what I mean is that it has little water with it. then it can easily crystallize and form a stone. Now, it's just like I give an example of when you are trying to make gari soaking, or you are probably trying to put a lot of salt in water. Okay, if you have little salt and plenty water, it can never crystallize. Right? It doesn't become solid. But if you have very little water and you keep adding salt, 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 it gets to a point where the salt will not dissolve anymore, right? If it doesn't dissolve with the body, then it tends to form that
Yeah.
stone. So think about stone as the fact that sometimes you cannot dissolve your crystals that are in your body, and then they form a stone, and they keep forming. It might be a little stone. Some comes to add on because okay, Christiana is not drinking water, not drinking water, not drinking water, and gradually it becomes a big stone. Now, when it becomes a big stone, a part of it can break off from your kidney, and when it is passing through your tube, that is when you feel the main pain. Now, the problem with stone and kidney disease is the fact that when you have a stone and it breaks and it is coming and it comes to block a part of where the urine is supposed to pass, then it begins to affect the kidney and it can give you kidney disease. So, we are not talking about stones. Like I said, stone is a whole topic by itself, and don't get me passionate about it, or else it will take all the time. But then
Yeah. Yeah. Maybe we might treat it. We might treat it one day. Yeah.
come again.
We will treat that one day.
Maybe what?
There's a question here. He says, what causes what causes kidney rejection after kidney transplant?
All right, so thank you very much. So one of the big challenges of the kidney transplant is the fact that, of course, it can be rejected. Now, the point is that I have my kidney. So just if I'm taking myself as a kidney disease patient, I have all my two kidneys now. They are not working anymore. Christiana, would you be happy to give me one of your kidneys?
Yeah.
Oh, you see,
It depends. Yeah.
your yes is not strong, and again, that is what people worry about. Okay, but let's say yes,
It depends.
you are happy enough to give me one of your kidneys. Now, I am Elliot. You are Christiana. The kidney that you are coming to give to me is Christiana is written on it. So the moment it gets to my body sees this Christiana and goes like, no, this kidney, there's no Elliot on it. So my body will begin to fight it because it sees it as a foreign body, or it sees it like some bacteria or some virus or some parasites, and it thinks that no, it's not supposed to be here. It's not supposed to be in this house. So that is how it fights it. Now, how do we prevent that? When you get a transplant, we put them on medication. And that medication is supposed to tell my body that please slow down. Don't kill Christiana's kidney that is supposed to save your life. So that's why we put them on medication. For some reason, when they are not taking the medication, or they miss their appointment, or they are not coming, or whatever, that is when they are at risk of what? Rejection. Okay. But again, your risk of rejection is also higher if maybe when you're on dialysis, we are giving you plenty blood transfusion. Okay. So when we give you plenty blood transfusion, we sensitize your body. So we have been giving you somebody's blood. So your body now becomes alert. So if it sees any other thing, it wants to come and fight it. So when the kidney is given to you, it comes to fight the kidney and it destroys the kidney. And that is what we give the fancy term as what? Rejection. Because when it fights the kidney now, the kidney cannot perform its function again. And unfortunately, it will not be able to serve you, and then you go back onto dialysis again. And that is what we call rejection.
Okay. So what someone says, what dietary changes do I need to make during treatment or recovery?
All right. So now that dietary has come in, I'll probably take advantage and talk about prevention. Of course, one of the key things we are talking about is here is how to prevent kidney disease. So for you to prevent kidney disease, to answer your question directly, one of the things we need to check is our diet. I advise people, please, 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 let's let more of the vegetables and fruits be part of our diet. Back here in Ghana, and I know amongst the blacks and all in the US, UK, wherever you find ourselves, we tend to be more focused on the carbohydrate part of our meal. In Ghana here, if you ask somebody, what do you eat in the morning? Oh, they will say maybe
Yeah.
porridge. What did you eat in the afternoon? Oh, I ate rice. What did you eat in the evening? I ate fufu or banku and all. We keep discussing our food based on the carbohydrate. Now I keep asking myself, why is it that when you go to the restaurant, they ask you that,
Yeah.
okay, what sauce do you want? All right, so I want beef sauce, I want chicken sauce, I want whatever sauce, I want vegetable sauce, and they ask you, what would you want to attach to your sauce? Would you want chips, or would you want fries, or would you want whatever it is like, so or rice or fried rice? So you see that the carbohydrate itself is not a meal. The meal is the sauce, and the carbohydrate is just supposed to be a little part that has to be on the side. Okay, so the carbo is not the main meal. Now our meal is all carbo, 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 and we are getting a lot of diabetes, getting a lot of all of these things happening now because we are carbohydrate based. Come on, guys, let's more be fruit bias, let's more be vegetable bias, and eat less carbohydrate. It helps a great deal. Now, salt is a big problem. So when I talk about dieting, I advise people on salt intake. Irrespective of whatever you are eating, cut down on your salt. Salt and hypertension are brothers. Salt and hypertension again are what? Brothers. Cut down on your salt to prevent hypertension. You might be listening to me, your mom is hypertensive. Before okay, your mom should cut down their salt. Your dad should cut down their salt. You are sitting in the house and you are eating your salt plenty. When you grow to your father's age, you also become hypertensive. What I advise you is that don't wait until you get hypertension before you cut down on your salt. Cut down on your salt
Yeah.
right now so you don't get the hypertension, which will eventually give you the kidney disease. Again, I've talked about the fact that, of course, we should eat in moderation and exercise, right? Exercise is always good. I mean, I am probably not to waste all the time talking about exercise, but it is fantastic. Let's exercise. And then again, let us make sure we take a lot of what? Fluids, right? If you take in more water, you decrease the pressure on your kidney to be able to serve you longer. If you are not taking enough water, your urine becomes concentrated, it becomes yellowish and dark and all. It tells you your kidney is struggling to keep the little water that you have in your body. When you drink a lot of water, you decrease the pressure on the kidneys. So you pee more, and the kidney is able to save you a lifetime. Okay. But the key is that if you are watching me and listening to me, if you don't know what your kidney level of function is, I beg you, after you finish listening to this video, go straight and see your healthcare provider and get your kidneys checked. More especially when you are diabetic, when you are hypertensive, you are above 30 or 40, and so on and so forth, because you'll be surprised. Maybe you already have some level of kidney problem, and you should check your urine also. Over to you, Christiana.
Okay. There's a question here. He says, I learned when you have kidney problem, you begin to feel heat at the back of your waist. How true is that? And also, how related is waist pains to a kidney problem?
Waist pain to kidney. How related to waist pain to what?
How related is waist pains to a kidney problem?
Problem. Okay. So what I'll say clearly is that one, kidney disease, typically chronic kidney disease, does not come with pain. More often than not, you have pain at the back or around your kidney for two reasons. When you have a stone, like I've talked about, and you have an infection in the kidney. But when you have chronic kidney disease, what we are discussing, typically it is not painful. If you are getting any pain on your lower back, I would advise you, my brother, my sister, check your posture. The way you sit at your workplace, you sit for long hours, your laptop is on your lap, and you have bent yourself like that, and every time you tend to have chronic backache. All right, so let's check the posture. It is not likely the kidney. The kidney typically will not present with back pain or waist pain or anything pain except for two reasons. If it is an infection or it is a stone. Chronic kidney disease is not doesn't come with waist pain. If your waist are paining you, I beg you, look for a musculoskeletal or it might be a problem with your posture, and you probably may need to see your doctor to solve it. Okay. Now, the key issue is that don't associate pain most likely to kidney disease except it is stone. I think that is clear. Did I answer all that question? There was an early part to it. I'm hoping I
Yeah.
answered it.
Yeah. Yeah. Yeah, it's the same. It's the same as the back and then waist pain.
Yeah.
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 Okay. Are there any orders? He says, are there any disorders that may worsen kidney failure?
Yes. So I think maybe whoever is joining now, but we've talked about them. Now the point is that the things that can affect your kidney more. I've talked about hypertension, I've talked about diabetes. Now that he's mentioned it, I'll probably add a bit more. When you are not drinking enough water, when you are taking a lot of painkillers without prescription. I think I should make time to talk about it. There are some people, my toe is paining me, painkiller. My back is paining me, painkiller. My this is paining me, painkiller. Does that work? Painkiller, painkiller everywhere. The more painkillers you take, the more damage you cause to your kidneys. Herbal medication, I've talked about it. In fact, people take all sorts of herbal medications for whatever reason. Please be careful about some of these herbal medications. And I'll say it and I'll say it again, Christiana. Don't be pushing herbal medications you don't know their effect on the kidneys. I beg you, because there are some of them that have problems with the kidneys. Right? So let's be careful about some of these medications we are taking. Now, again, when you are obese, when you are becoming too fat, in our part of the world, when you are becoming big and fat and your butt is becoming big, there's something with you, or your husband is keeping you well, or good living, or life is good, and all of that. I beg you, too much weight gain. Now, you see, Christiana, your kidney size about the size of your kidneys are about the size of your fist, right? Okay. Now, I ask myself, if you keep becoming big, you are supposed to be like this, and then all of a sudden you become like that, the kidneys don't become any bigger. They are about the same size, and they have to take care of the whole body. So maybe you are weighing, let's say, 50 kgs, and now all of a sudden you are weighing 100 kgs or 200. It's the same kidneys that are supposed to serve you. And they're going to get tired as they keep serving you. They're going to get tired. So obesity itself is also another problem, and that is why I advise people to exercise, eat well to maintain a healthy weight, because all of that will prevent you from getting your kidneys getting worse. Okay. So I think these are some of the basic things. And let's make sure that when we get sick, we
Yeah.
go to the hospital for proper treatment and not take anything that will worsen our kidney function.
Okay. And then, what advice do you have for those who drink and smoke?
Thank you for
What
bringing this up.
effects do
When I'm
they
talking
have when they
plenty,
drink and smoke on
when
their?
when I'm talking plenty, I forget about the alcoholics. Right. The alcoholics. Plenty alcohol. Plenty alcohol is also a problem. Alcohol can give you hypertension. Alcohol over a period of time can affect your kidney, can affect your liver, can affect your heart. So it probably doesn't affect the kidney alone. But and the alcohol again also sometimes, if you take it in large quantities, of course, I mean, then you divorce rate and you are losing money and all of these other things about alcohol. But we're talking about kidney disease now. A lot of alcohol can affect the kidney. Please take it from me. And then again, the smoking. But the good news, I mean, so just for some of the little social drinkers, oh, me, I don't drink a lot of alcohol except during engagement, except weddings and all. That one, there's evidence to show that moderate intake of alcohol is safe for your kidney. Moderate intake of alcohol is good for your heart. But Christiana, the difficult question is always, what is moderate? My moderate, Christiana, might be different from your moderate, right? So unfortunately, that's where the problem comes in. So
Yeah.
moderate, we have decided, or in fact, in terms of not decided, but we have concluded that maybe if one, let's say one jug of beer is 1 unit of alcohol, of 1 unit of alcohol. So one jug of beer once a day, probably for a female, is assumed okay. Anything more than that, you are an alcoholic, or it will have risk of kidney disease. One, what do you call it? One glass of
Yeah.
wine every day, at least once a day for a week, is fine. Anything more than that is more than moderate. So once a while, if you go for a function and you take a little, red wine and all, that take it from me. There's no evidence to show that it's bad for your kidneys. Indeed, it is actually healthy for your kidneys. But don't abuse it, all right? And take more. Just a little is fine. Too much of it is bad. Smoking, big problem. In fact, smoking, please, 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 if you have not started smoking, don't start it. Don't let anybody deceive you that it shows that you are a guy, it shows that you know what's up, or you are whatever, all sort of nonsense. The point is that unfortunately, when you start it, you cannot stop it. So I keep advising, if you've not started it, don't start. And if you have started it, sometimes you need a psychologist to help you, or somebody to help you break the addiction. And stay away from those friends who keep encouraging you to smoke and drink. They are bad friends. Anybody who takes you out and says that if you don't drink or you don't smoke, they are not our friends, please stay away from them. Come and be my friend. I don't drink, I don't smoke, and I'll be your friend. don't follow them because they lead to cancer. Is that okay? So alcohol and smoking, I have mentioned, please, smoking is bad, bad, bad. Not for the just for the kidney, for your heart, for your lungs, for everything. And now there's COVID. If you smoke, COVID will kill you, right? Mm.
Mhm. Okay. So someone is asking, he said if he said but if my kidney problem is chronic, how long can I continue without dialysis? Or will I ever need dialysis? Does it mean apart from dialysis, is there any other yeah thing that they can use?
Yeah, so you need to see your kidney specialist. I mean, so that's the first thing. So if you're in Ghana, you need to see a kidney specialist. And indeed, what we do is try to make sure it doesn't get worse. All right. So we'll see you. And indeed, I've had people who have had kidney failure for what do you call it, kidney disease for what, 5 years, for 6 years, for 10 years, and all. It all depends on how you take very good care of yourself. Unfortunately, depending on what is causing it and how fast it's destroying, in most situations, when you see people in about 6 months, about a year, they are going to need dialysis. But again, I will not generalize it. It all depends on your particular state. So you need to see your doctor, will wake you up, know the level of your function, and make sure that they take care of you so you don't run into problems.
Okay. So apart from these painkillers, because we those of us in the UK here, when you go to your general practitioners or you call them and tell them that oh you have a headache, you have this, all they give you is paracetamol, or they tell you take ibuprofen, take this.
Dangerous.
It's all about
Dangerous.
painkillers. So how do we prevent it? How do we prevent it?
Ibuprofen, diclofenac, I can go on, naproxen, all of those, we call them NSAIDs. They are terrible for your kidneys, they are terrible for your heart, and they should not be abused. Indeed, those medications, most doctors will give you so you stop worrying them because you keep calling, okay, take this and then I'm fine. But
Yeah.
please, it is important that if you have any pain, your doctor's first responsibility is try and find out why is the pain there and try to look for reasons for it. In fact, I will tell you that there's a patient I have who, in fact, used to have chronic headache, and had been seeing doctor. They kept writing painkillers. Now, when I saw him the first time, his kidney functions were down. Guess what? Because his blood pressures were high. He was getting the headaches because of the high blood pressure. High blood pressure or hypertension can give you headache. So instead of we controlling the blood pressure with medication, he was taking painkillers, which was also now destroying the kidney. So now you have two things destroying the kidney: the blood pressure itself and the painkillers. So now the point was that okay, I stopped the painkillers, and now I have made sure I control his blood pressures. And he told me that ever since we started meeting, now he had no reasons to take painkillers anymore. So as healthcare providers, or as doctors or as nurses, when somebody comes with pain, it's not about okay, go and take this and leave me alone and let me mind my own business. It's about why is the pain there and look for solutions for the pain.
We made mention of kidney rejection. You know, before a kidney transplant, they do series of
Oh,
tests to see if you are compatible with that
yeah.
kidney. So why is it that after that you get a rejection?
Yes, so we do all of that, and thank you for that. We do all of that to assess your risk and hope you don't reject. But after all of that we do, it doesn't mean that if you're a perfect match, it means that your body still thinks, or like the example I gave, that my body will still think that the Christiana kidney that has been given to Elliot will now change and be called Elliot. The body will not. That is the body's way of protecting you. Anything that enters the body that is not familiar with, it has to make sure it attacks it. And it will do that, though we have done all the necessary tests. But all the tests that we do will prevent what we call the acute rejection. So if we had not done the test, what will happen is that the moment we put the kidney in, before the surgery is done, the kidney will become black and it will get spoiled, right? So that is why we do those tests. But chronic rejection, you have to be on medications for a long time so as to prevent that. So the two are different. We do the test to prevent the acute or the acute rejection. But as for chronic rejection, by the virtue of the fact that the kidney is still there, the body still tries to look for ways to attack it on the side. And that is why you need medications to ensure that does not happen for the chronic rejection.
Someone said a friend has been taking reason. I don't know what that reason is anyway, for his itching condition for a period of time. What advice do you have for him? And what is the reason? What is it,
That's
please?
if he has kidney disease, yes, kidney disease sometimes can do itching. But if you are itching and you are not too sure what the reason for the itching is, there are 1,001 things that will cause itching. You may need to see a healthcare provider.
No, he means the friend has been taking reason. That's
Rising, that's rising.
RIZEN for the
Rising,
itching.
yeah, rising is a medication.
Is it rising? Yeah.
Rising is a medication that helps you to not to itch. All right. So, but the point is that he needs to find out from his doctor why he's itching. Like I said, there are so many reasons why people itch. People sometimes itch because of the water they are using. People will itch because of their HB or their anemia levels or their iron levels are low. People will itch because they are not bathing well. People will itch because they have all sorts of maybe infections on their skin and all of that. People will itch because they have dry skin. So that I can't go on and on and on. There are 1,001 reasons why people itch. The doctor should find out why he's itching and treat it. Yeah.
We've run out of
Yeah.
time. Maybe we might have to fix another date and then go deep into it, the various kinds of kidney diseases. Can you please wrap up and give us some advice to the viewers out there on how to prevent it, and then when to see a doctor when they have signs or symptoms of this kidney disease?
All right. So yeah. So thank you for joining this podcast. And indeed, we've discussed all about kidney disease. And if you probably did not start from the beginning, I think it's going to be available on our walls, so you can just keep following. And because of you guys, I'm actually also bringing up a book. And in fact, all I've talked about in that book is about how to prevent kidney disease. Most of these things I'm telling you are all in that book. And it's going to be made available online. We are waiting sooner than later to do some online launching of some sort. Maybe Christiana will help me also launch on the platform. And we are going to get electronic copy. It's going to have PDF copies. So wherever you are, of course, if you're in Ghana, you can get a solid copy also. And I would advocate that everybody tries to get that book to read. It will let you understand what you are, that the fact that you are sitting on a time bomb, if you are sitting aloof, not checking about your kidney disease. Why? Because kidney disease is very common. About 10% of us have kidney disease without our knowledge, and most people don't know. Unfortunately, they will come in when it's so late. And I want you to be knowledgeable. If I've spent over an hour to discuss this, I think it's very important that you make time to watch it over and over again. If there's anything you don't understand, you can send a message to Christiana's wall on Facebook or YouTube or whatever. Or you can get me also on Elliot Franton channel or Kidney Consult, any of my walls. Send a message, and if I find the time, I'll be happy to respond. But grab the book and help prevent yourself from getting kidney disease. Thank you very much for joining us.
Thank you so much, Doctor, for your time. We really appreciate this. And then viewers out there, thank you so much. And we'll find another time and invite Doctor to come on again. So next week, same time, we'll bring you yet another great topic on Yes to Healthy Life. See you next week, and goodbye.
All right, bye-bye, and take care of your kidneys. Your kidneys health is your responsibility, right? Okay, bye.